going to inject Naldebain, it is very important to inject it into the muscle tissue layer. If, instead of injecting it into the muscle layer, you inject it into the fat layer or subcutaneous tissue, the drug will not release because it is an oil-based injection and it would be trapped in fat tissue. The body does not have the ability to properly absorb the drug. What's worse is that it becomes a hard nodule. The hard nodule will cause post-injection discomfort, which will last a long time because it needs to be absorbed by the body, which will take a long time. Therefore, it is very important for this oil-based injection to be injected into the muscle tissue layer of the buttocks. If you use an ultrasound, you can clearly see when the needle hits the layer of muscle tissue and at that point, safely inject the medicine. But you can still use this medicine if you don't have an ultrasound. To find the safest place to inject the medicine, divide the buttocks into 4 quadrants, and in the upper outer quadrant, draw 4 more quadrants, and use the upper outer quadrant as the injection site. This is where the piriformis muscle is located. The sciatic nerve branches out from here and it passes through the intersection from the first quadrants we drew. This intersection here. If you inject the medicine here and you push the needle a little too deep, you will hit this nerve, which would be harmful to the patient. With patients who have larger buttocks, it can be difficult to assess the proper injection depth. It's better to inject here. At this injection site, you can completely avoid the sciatic nerve. What's in this area? Apart from skin, subcutaneous tissue, and muscle, this is the location of the gluteus medius. The gluteus maximus is here. With the ultrasound, you can see the gluteus medius. Inject the medicine here. It's easy to inject into the muscle layer, whereas over here the adipose tissue is relatively thicker. Here, it's relatively thin and easier to perform the injection. Let's sterilize the area and perform the injection. While injecting the medicine, pull on the skin a little to make it taut. Wait to release your hand until after injecting the medicine and removing the needle. This will ensure that the medicine stays locked inside the muscle tissue layer. Okay, let's perform the injection. Take a deep breath. My method is to take a deep breath and then insert the needle. Next, you can push the needle a little deeper and then pull the plunger out a little bit. There's no blood. This means that we are not injecting into a blood vessel. You can slowly inject all of the medicine. Make sure that all of the medicine gets injected and there's nothing left. Next, remove the needle and then you can release your hand. This way, you can successfully complete the intramuscular injection in a single attempt. In this area, the needle does not need to be too long because the fat tissue is thin, so it's easy to reach the gluteus medius. Injecting into the muscle layer is the safest. I have performed hundreds of Naldebain injections using this method. Basically, there haven't been any accidental injections of the drug into the adipose layer that would lead to complications.